All right, welcome back to East Texas Now. And I told you next week going to be a big deal across East Texas because, well, it's National Public Health Week. And UT Tyler School of Health Professions is putting on events all across East Texas, or Tyler really, to highlight the importance of public health, as well as the importance of the important role professionals, scientists, advocates all play in making sure our community is healthy. And joining us now, and I'm so excited for her to come in. I know it was rainy this morning. You've been super busy. This is Dr. Teresa Bird joining us with, well, just, getting a better understanding on exactly what all is going to be, expected for next week. For those who are completely unaware, what is the purpose of National Public Health Week?
Well, National Public Health Week has been going on forever. It's always the first full week in April, and it was started by the American Public Health Association, sort of to celebrate public health and let people understand what is public health, because most people really don't think about public health that much or really know what it does, so
Right.
That's really the purpose of National Public Health Week.
Okay, and then who started this awareness week? Do you happen to know? Or when did UT Tyler really pick up the role of okay, we're going to be the streamline to help Tyler know what's going on, what they need to know?
Well, it was actually 3 years ago when I first started here. Public health is my passion, and so I was started the first of our National Public Health Weeks, and this will be our third one. And so we're really excited about it, and we're ready to go. Ready, set, action. That's our theme.
Does a lot of preparation come into play when getting ready
yeah.
for this?
Yeah, we've been meeting with community members and other faculty for, I think, probably about 4 or 5 months to put it all together.
And in the past, have you seen that it's been totally worth the time and the effort going in?
I think it's always worth the time and the effort. It gets the students excited about public health. It gets folks in the community to understand what public health is, and the mayor's always been involved every year, so that's kind of fun.
So you've seen a pretty good community response to it all.
Yes, yeah.
I love that.
Yeah.
Now, on the website, on UT Tyler's website, and I'm going to pull up a quote that we have here, and you can see it up on the screen in the outlined green box. It says here that National Public Health Week is inviting Americans to renew their commitment to strengthen the systems, science, community partnerships that keep us healthy. Now, what are some of these systems and partnerships that this quote mentions?
Well, when you think about public health, most people don't really understand what that is, but public health is all about the health of populations. So our patient is the population instead of an individual. But that doesn't mean that medicine's not involved. So the systems include your public health systems like NetHealth, and DSHS, the Department of State Health Services, who really take care of a lot of the governmental public health, but also medicine and pharmacy and occupational therapy and physical therapy and nursing. All of those folks are part of public health. And I like to talk about engineers and people who architects, because they're also part of public health. Because one of the things we think about is healthy environments and healthy housing. And water systems, worldwide, the biggest health problem we have is lack of access to potable water. That's what's killing people all over the world. So engineers need to get out there and dig wells, and figure out how to get water systems set up. So it really does take everybody to have a healthy population.
It's beyond the idea of a person in scrubs.
Exactly.
I love that. And so what does the renewing our commitment look like? How does that put into practice?
Well, I think we're talking more about renewing our commitment because, as you might have seen, public health has been under a little stress. CDC's been under a little stress. And so really thinking really strongly about what is our commitment? What is it that we want for our communities, and how are we going to make that happen? And I think that's so important right now because a lot of things are kind of under fire, and we're trying to figure out, what does the public really want? What do they really think? And how can we help them understand better what we do?
Now, this year's theme, and you said this moments ago, the Ready, Set, Action. What's the goal behind this mission statement?
I think the goal, and of course we didn't do that, that was the American Public Health Association, but I think their goal is that we've been through the COVID, we've had a pandemic, we're kind of trying to recover, and so we're ready and set, and now it's time to take action. Let's do it. Let's make healthier populations.
I love that. And I'm going to pull up another quote here. It should be popping up on your screen now. Something I really like, and I just wanted a little bit more explanation. Good health doesn't just happen.
That's right.
Talk more about that.
Okay, well, let's talk a little bit about the history here. In 1900, the average lifespan in the United States was 47. And now, we're in the 70s, right?
Right.
And so when we look at that 30-something years of change, we know just from looking at the data that about 25 of those years are due to public health issues, not medical. So about 5 of those years are medical changes, like better drugs, better tests, all those things. But 25 of those years has to do with public health. And public health is responsible for things like clean air, clean water, clean food, vaccines, which have saved millions of lives, especially back in the time of polio and smallpox. And so it's really thinking about that as a whole and thinking about human health as a whole. And we know that the top killers in the United States are cancer, heart disease, stroke, and accidents. But we know the actual causes of death are tobacco, poor diet, lack of physical activity, and overuse of alcohol. And so if we can help people change those behaviors, it would be amazing. And I have a colleague who always talks about it's what we do with our forks, with our fingers, and with our feet that are really important to improving our own individual health.
How can we as individuals contribute to this mission?
I think individuals can contribute by learning more about the health issues that are happening in our community. And we're about to come out with we have a report that's done every 5 years that talks about the health of Northeast Texas, and that's coming out soon. But, being aware of what our issues are and helping their neighbors also figure out ways to be healthier. And when we talk about health, we're not just talking about physical health.
Right.
We're talking about emotional health, mental health, spiritual health. And we know that there's a kind of a problem with loneliness in the United States right now. In fact, one of our surgeons general wrote about that a few years ago, this epidemic of loneliness. And that is not good for your health.
No, it's not.
And so trying to interact more and join more community events and getting to know your neighbors, that's really a big important part of everyone being healthier.
And they all kind of go into one, because when you don't take care of your mental health, you don't feel the urge and the need to take care of your physical and to even reach out to your community like you mentioned.
Right, exactly. Right.
So it all just kind of plays in together and could snowball into a much larger issue.
Right, exactly. So really getting people together as a community, that's part of what National Public Health Week tries to do, and hopefully they'll maintain those ties.
I really enjoy getting to talk to you. So in your perspective, what is some of the big needs to do to take care of ourselves or just live healthier? Because I think you talked about it with getting into your community, being aware of the kind of water you're drinking, but how does that expand to our community members and our neighbors, like you mentioned moments ago?
Well, I think, the thing that's really important is to be sure that you're eating healthy foods. That's very important. And there's so many different, you can get the diet of the week. I mean, somebody's going to tell you, just eat meat, just eat this, just eat that. Really, what the data are showing us is that the Mediterranean style diet is probably the best. And the most important part of that is fruits, vegetables, and whole grains, and fish. And so changing your diet a little bit, not drastically, you don't have to stop eating every single hamburger, but, adding more fruits and vegetables goes a long way. And then moving more. We're unbelievably sedentary in America. We don't walk a lot. We don't do physical labor as much. And so making sure that you're moving your body really makes a difference in both in your physical health and your mental and your cognitive health. It helps your brain.
So going back to those three elements, what you do with your mouth, your hands, your feet, it all has to play together.
Right, exactly.
I think that's awesome. Okay, so let's go into the different days that we have coming up next week. So let's start off with Monday. I'm going to pop this up on our screen here. So Monday, What's the big goal here?
Monday is our big kickoff, and it's going to be at the African American Museum, and it starts at 6 o'clock in the evening. And Texas College Choir is going to be there. We're going to give out some awards for some video events that we had people working on. And we're going to talk about the importance of mental health. And I think it's going to be a really good kickoff because mental health it's just so important. And it's really a problem right now in our communities.
Is there a reason you chose the African American Museum to be the start off?
Well, the actual reason is because one of the people who works there is on our planning committee.
Oh, I love it.
And I didn't even know about the African American Museum. I was just like, what? What's that? You know?
Absolutely.
And she said, oh, yeah, you've never been? I said, no, I've never been. So we thought, well, that's a great place to start. So that'll be our kickoff.
All right. And then Tuesday we have, and I'm going to pull it up full screen, it's Fit City Tyler Expo. Walk me through what that is.
That is put on by NetHealth every year. And this year we kind of got it as part of National Public Health. We claimed it.
Yes.
Yeah, and that's going to be amazing at the Rose Garden. It's going to be from 4 to 7. And they're going to have yoga and Pilates and a walk with a doc through the Rose Garden. And then lots of booths, tables of people who come from all over, all different kinds of healthcare people. And people can probably get their blood pressure taken and talk to some of our medical students. And so it's going to be a really nice event to celebrate.
And this is open to everybody,
It's
all
open.
of the events.
Yes. Oh, yes.
Awesome.
We want everybody to come.
And then we're going to Wednesday now, popping it up, video screening, health cooking classes.
Yes.
Okay, so this is kind of in the daytime hours.
Right.
Who is the perfect person to go to this event?
I would think someone who is really interested in changing their nutrition.
Okay.
Because we're going to have one of our nutritionists that morning who will talk about nutrition and also demonstrate how to cook some healthy foods. And then we're also going to have someone who's we're going to screen some films that people can just go in and out of, but we also have someone who's going to show us the SMILE. What does that stand for? The simulation lab that our medical and nursing students use. And he has a virtual tour of the simulation lab so people can see what are those medical students and nursing students doing in there.
Right. Oh, absolutely. Especially with the new equipment they have in there,
yeah.
the robotic patients.
Oh, yeah.
Which, outside looking in, it looks a little spooky, but it's interesting, and it's that bedside manner that you can't quite teach, and this is kind of like the next step towards
Right.
it.
Yeah. And you can get those mannequins to react in certain ways. You can get them to cry.
Yes.
They can do all kinds of things. So it's really interesting.
So when we were talking earlier about food being important, do you think the Mediterranean diet is going to be something of focus during this event?
I'm fairly certain she will talk about that, yes.
Okay.
Because she's a nutritionist and she likes to talk about nutrition.
Oh, I don't blame her.
She loves it.
I've been hearing so much about the Mediterranean diet lately, so it's curious to see how experts, really put it front and center, like why this is so important and why
Right.
it's mandatory, or not mandatory, but better for you.
Better for you, yes.
So for Thursday, CPR and AED. This is so important, and I know there's more folks getting on board to take these classes. So this is just a full demonstration.
It's a demonstration, and it's going to be on the campus, the academic campus in the student center. So it's focused mostly on students, but anyone can go. And it'll be just demonstrations they use, and it's people from the American Heart Association. They use fun music to show you how to do CPR.
We got to keep those entertaining. Got to keep everyone's attention.
Yeah, that'll be fun. Yeah, and then we also have a conference over on the North Campus, which is put on by our preventive medicine department, and they're going to do a lifestyle medicine conference.
Oh, that's cool.
And if you happen to be a provider, you can get continuing education credit for that.
I want to ask a question about that in just a moment, but with the event for this, can people get their certification to be CPR?
Not with this one.
Okay.
That takes a long time. That takes several hours. So,
Okay.
But I hope it's going to get the students interested.
Yeah.
And then going to the American Heart Association and taking some certification courses, and also just knowing where the AEDs are.
Yes.
Because I don't think most people actually pay attention.
or look for them because
Yeah.
you see the signs for the fire extinguisher and what have you, but this is good to know
Right.
and at least know how to help someone who is certified.
Right, exactly.
Now,
Right.
with the other event that you said going on, Explain a little bit more what that is. What is it? Preventative? Is that there?
It's lifestyle medicine.
Okay.
And it's put on by the preventive medicine department. So we have residents who are preventive medicine physicians.
Okay.
And so they're putting this conference, their first time to do it. And lifestyle medicine really talks about a lot of things we just talked about.
Right.
Nutrition, physical activity, ways that people can improve their health and prevent disease.
Okay.
And so these are physicians who are trained specifically to think about prevention of disease instead of just treatment of illness.
Right. Because just looking into some of the stories that we have often about, more and more people getting diagnosed with this or this, it almost feels like sometimes we're treating the symptoms rather than the bottom line cure, which is what this whole day is looking at, the
Right.
bottom basics of it all.
Right. How to prevent disease before you get it. Yeah.
Exactly. And then Friday, is this the big party?
Friday is grand rounds. Grand rounds are things that the medical school does every Friday.
Okay.
But everyone's invited. It's all online. It's on Teams. We'll have the link out so people can link to it. We're going to have a panel of people talking about their involvement in public health and what public health means to them. And two of them are public health people, but one is an engineer.
Okay.
And the other one is a journalist.
Oh, I love this.
Yeah. So talking about how does what you do add to the public's health? Because like I said, it's not just us, it's everybody. It's
Right.
education, it's, even police have something to do with public health, especially now when we have people with mental health issues and the police are being trained now to deal with that better. So, I think it's going to be a really interesting panel.
And this, you said that y'all do this every Friday. In the past few years that y'all have done this event, what are some of the best discussions you think have come out of this?
Well, actually, our first year of doing National Public Health Week, we had Dr. Kenneth Cooper come. I don't know if you know Ken Cooper.
The
Of
name
the
sounds
Cooper Clinic.
It sounds familiar.
He's kind of the father of aerobics.
Okay.
Ken, when he came out to see us, it was 94.
Okay.
And he's still running around the stage and talking just as fast as he always has. And he started the Cooper Clinic in Dallas, which is all about prevention through diet and physical activity. And he really is a big physical activity buff. He was an athlete, I think, in college and stuff. And he just turned 95.
Oh,
I saw him online, and he was receiving an honorary degree from Texas Tech University Health Sciences Center. But, and he was celebrating his 95th birthday. And he's slowing down a little bit, but he still looks pretty good.
he's a product of what he practices.
I joke around with him because I told him when he came out here, I said, I met you when you were just like 60, because I had known him for many years.
When you were so young.
When you were so young, you were just 60. He said, yeah. And actually, he was limping a little bit a couple of years ago, and I said, what happened? He said, a couple of months ago, I had a skiing accident. And I thought,
Okay.
a 94-year-old was skiing. Okay.
Oh my
Good for you.
goodness. So,
Yeah.
I know there's a lot going on. If for someone who has a very tough schedule, what do you think is going to be the day that really is going to benefit them the most?
Probably, well, I think that the most fun might be the one at the African American Museum, because
Oh,
just
yes.
like, let's
Just
just see
being
what that
there.
is, hear in the
Yes.
choir. I think the most beneficial probably for most people would be the Fit Tuesday thing.
Okay.
The Tuesday event.
And that's going to be in the afternoon, so it'll be
Fit
perfect
City,
for families to come out. Is it family friendly?
Oh, yes.
Okay.
Yeah. And that starts I think it starts at 4
I'll
and
pull
goes
it back
until
up.
7.
Let me pull that
4
back
till
up for
7.
us. Here it is. For those who want to screenshot it, it's up on
Yeah.
your screen
So
now.
Fit City Tyler. I think that one, because there will be so many people there who you can talk to about different aspects of health. And
So
I
a
think,
lot of resources available.
yes, a lot of resources, and also a lot of fun activities if you like yoga and Pilates and
Oh, yes, ma'am.
walking through the rose garden.
So, to wrap everything up, is there anything else you think that we need to know before we kind of head off into our next topic, or how do you feel? Did we cover everything you wanted?
We covered a lot, and all I would add is, remember your public health professionals. They are here. They're sometimes not very visible, because a lot of what we do in public health is behind the scenes. And if you're preventing stuff, nobody knows that it was going to happen in the first place, so that you don't always know. But public health professionals are really important, and we need to celebrate them.
Absolutely. Doctor, thank you so much for joining us.
Thank
I'm so
you.
excited to have you on.
Thank
Can't
you.
wait to see how it all plays out and have you back next year.
Thank you so much. It's so good to meet you.
It's so good to meet you, fellow redheads. What are you doing?
Redheads, yeah.
That's right. All right, we're going to take a quick break and then we'll be back in just a moment.